Welcome everybody to Quadrio Smart online course. I am Dr. Nada and I will present ethics and communication skills. So let's discuss a scenario. You have 5 minutes to read the following scenario. Please read it carefully and plan your answer within the given time frame. Explanation of the correct answer and feedback will follow. This is the scenario. Please read it and plan your answer, and then we will proceed with the explanation afterwards. So I will read the scenario for you. The role: you are the SHO doctor in the neurology clinic. Please read the scenario below. You may make notes on the paper provided, and when the bell sounds, enter the examination room to begin the consultation. Miss Rosa Fletcher, she's 29 years. This lady had presented to a hospital casualty department following 2 fits and was reviewed by the medical registrar. She was diagnosed with epilepsy and started on sodium valproate, and she was discharged with an outpatient CT scan of the head and an EEG. The consultant neurologist has reviewed the case notes and the investigation results and feels that they are in keeping with the diagnosis of epilepsy. Ms. Fletcher has now come to her first appointment, and your task is to explain the diagnosis with her and discuss the relevant issues. You have 14 minutes to communicate with the patient, followed by 1 minute for reflection before discussion with the examiners. You are not required to examine the patient. So let's plan and analyze the scenario all together. During the 5 minutes before you enter into the exam room, you should do the following steps. First of all, as you can see, I put a line under some keywords which you should consider during your planning of the scenario. Like here, for example, there is a line under SHO doctor in the neurology clinic. This is the role you should mention to the patient, your role when you introduce yourself. And then there is another line under 29 years. The significance of this is that, as you can see, there is another line under this lady. So we have a female patient within the reproductive age group. I'll explain to you later the significance of this. Then there is another line under 2 fits, the word 2 fit, these 2 words, 2 fits, okay? Another line under sodium valproate. So 2 fits means that this is not a solitary fit. The significance of 2 fits means that she has diagnosed with epilepsy and there are some DVLA issues that you need to discuss with the patient, okay? And we will explain that further in the coming slides. Sodium valproate is the kind of medications she's taken, because there are some safe antiepileptic drugs and drugs of choice during pregnancy, and other drugs which are not safe during pregnancy. So it's important to consider which kind of medication she's taking. Then there is another line under diagnosis of epilepsy. Then your task is to explain the diagnosis. So you're asked here to use the skills, communication skills of explaining a diagnosis of the given disease, which is here epilepsy, and discuss the relevant issues. So you have to discuss any related relevant issues to this disease and consider the concerns of this patient regarding this disease, okay? So take a look here at this slide. This is how you should plan your answer. So in the 5 minutes before entering the exam room, read the task card, use the piece of paper in front of you to plan your answer and organize the structure of the consultation. So as you can see, the figure in light blue, which represents the structure of the interview, you should enter into the exam room with this structure in your mind. You know that you should start with a proper introduction, you should assess understanding of the patient, and also address any ICE, which stands for ideas, concerns, and expectations, and then you should proceed with explaining the given diagnosis, which requires some specific skills, which I will explain in a minute. Okay, there are some skills specific for explaining a diagnosis of a given disease. Approach there is an approach, specific approach to do that task, okay? And then afterwards, you should address any questions or further concerns the patient may have, and finally summarize and end the consultation. So the figure in violet, as you can see, explaining the diagnosis skills, which is your given task. The incidence and prevalence of the disease should be discussed here. Normal anatomy and physiology, pathophysiology, clinical picture, and the possible causes and risk factors. Any triggering factors, okay, should also be discussed. Any related problems and complications and any alarming signs and symptoms which indicate that the patient needs to present to a hospital urgently if these develop, and then explain the plan of management, okay, including the follow-up plan. So this should be done in the 5 minutes before entering the exam room. So when you enter into the exam room, you have the structure of the interview, and also you have the specific skills to do your task. By that, you have the lead. You are leading the discussion, okay? So let's see the further details and how this is done. After you have planned your scenario, you should enter into the exam room. Now, your 14 minutes with the surrogate has started, okay? So you should start your consultation. Greet the patient, say good morning, and then confirm the patient's ID. The significance of confirming the patient's ID is to strengthen the bond between you and your patient and break the ice and so. And then the second significance is for confidentiality issues. It's important that you are talking to the same person. You are explaining a diagnosis of a disease, the investigation results of a patient. It's important that you are talking to the same patient, okay, for confidentiality issues. Number 3, introduce yourself and tell the patient what your role is. That should be present on your task card, okay? Like here in the previous scenario, you are the SHO in the neurology clinic. Then establish rapport, which means that you should start or initiate a small discussion by, like, for example, asking the patient how they are doing or if they are doing fine now. And that is to break the ice between you and the patient and make it more, make the environment more friendly, okay? Then you proceed by explaining the agenda. You should explain why the two of you are present in this meeting today. Like, for example, we are here today to explain the results of your investigation and the diagnosis which we reached, okay? Then assess understanding. Explore the patient's problem. Find out what he was told so far or she was told so far, okay? Address any ideas, concerns, and expectations. And here are some useful sentences that you can use. Like, for example, have you had any idea what's going on? Or did anyone explain to you what's going on? Okay, these are some examples. So after that, after they answer the question, carry on by telling the patient his own story from the information you got from the card and the patient himself. Number 7, now here you should do your task. So the previous 6 steps are steps which are common in most communication scenarios. This is how you make a proper introduction. So you are following the structure of your interview. Now, number 7, you should do your task. So here you should use the specific communication skills for explaining a diagnosis. So here in our example, it's to explain the diagnosis of epilepsy as shown in the example scenario. All right? So you should start by explaining the incidence and prevalence of epilepsy, and explain the normal anatomy, physiology, pathophysiology, explain possible causes and risk factors, explain the clinical picture, including any aura or post-ictal confusional state or so on, all right? And the entire clinical picture. Then tell the patient when to seek urgent medical advice, and if any alarming signs or symptoms develop, explain any complications of the disease, okay? And after that, you should also consider any risk factors, as I already spoke about them. Now, number 8 is to explain the management plan of the given disease, which is epilepsy here. So start by explaining the non-pharmacological management as lifestyle changes. Epileptic patients may have some triggering factors in their lifestyle, which triggers the fits. So here you should advise patients about changing their lifestyles and avoid these triggering factors. Any dietary issues should be discussed, any alcohol consumption. For example, illicit drug abuse, sleep deprivation, flickering or flashes of light, stress, all these can trigger a seizure in a susceptible person. So you need to educate your patient about and advise them, counsel them about changing their lifestyle to avoid the triggering factors. Pharmacological management includes possible choices of antiepileptic drugs. You should discuss that. You should discuss the side effects and indication in the effect of these drugs on pregnancy, etc. Explain the follow-up plan. Now, assess the eyes, ideas, concerns, and expectation. Ask the surrogate what she thinks of what you said. Any ideas, any opinions, any concerns, fears, or questions, and deal with them. It's important that you ask the patient about her concerns, and it's important that you solve these concerns. You're not just asking just to know what her concerns are. No, you need to solve them, okay? And you will be marked for that in the mark sheet. Concerns are very important. Number 10, ask how the information supplied or decisions taken would affect her life and offer help accordingly by referring to the following as indicated. For example, epilepsy medical society, epilepsy support groups, specialist nurses, rehabilitation programs for epileptic patients, any social services whenever needed, dietary advices, and so on. All right? And if there is any effect of this disease on their life, you should deal with these concerns and solve them. Okay? Number 11, summarize the whole scenario with your suggested plan, including any follow-up plan. Close the consultation by offering contact details, follow-up or referral appointment, leaflets, pamphlets, websites for further information. Thank the patient, wish them best of luck, or seeing them again according to the scenario. There are some other aspects which must be considered, as, for example, addressing relevant social issues, alcohol issues, drug abuse, the use of illicit drugs, okay? Any social problems met by the patient. So these should be dealt with and discussed and solved. You should help the patient out with these problems, all right? Driving issues and fitness to drive is another issue that needs to be discussed. You need to ask the patient if she's driving or not, which type of license she's holding, and also what she does for a living. Our patient in this scenario, okay, when you ask her and you discuss the scenario and practice it as a real scenario, this is what we are actually going to do in our lectures. We have a full lecture about fitness to drive, considering several diseases and the basic key points and approaches you should follow when dealing with a scenario like fitness to drive. Okay, we'll discuss that further in that lecture. Okay, so you need to know if the patient is driving for a living or not, and how you should advise them accordingly. Then after that, safety in pregnancy is also a very important issue to discuss. As I said, the patient is in the reproductive age group. It's important to ask her whether if she is pregnant at the moment or not, and if not, is she on any oral contraceptive pills. Please pay attention to drug-drug interaction between oral contraceptive pills and antiepileptic medications or epileptic medications. Okay, please pay attention to any drug-drug interaction. A patient who is on epileptic medications, you should ask her, as I said, if she's pregnant or not. If not, if she is planning to have any children in the near future. If not, meanwhile, you should keep her on a safe contraception method. Okay? As I said, oral contraceptive pills may interact with antiepileptic medications and she may get pregnant. So if she's not thinking of having children in the near future, just refer her to a gynecologist, for example, in order to keep her on a safe contraceptive method. And as soon she is planning to have children, then her neurologist will change her on the drug of choice during pregnancy, and also The contraceptive device will be removed by the gynecologist, and she can conceive while on a safe epileptic medication. All right? You need to educate the patient about that. So this is very important to consider in your discussion. Then be ready to respond to questions regarding occupational issues. You have to address any issues related to their work, to their job. You have to make sure that they are not at risk because of their occupation. You need to make sure that they are not dealing with heavy machinery, for example, or they are not practicing a job which is dangerous for them, like they are not divers, or they are not, for example, swimmers, or so on. And they are not drivers, because epileptic patients or patients with epilepsy who drive for a living, they need to stop driving. They need to inform the DVLA, the Driving Vehicle License Authority, okay, and they will be stopped. They will be banned from driving for a specific time. We will discuss this further in Fitness to Drive lecture. All right. Some confidentiality issues may also arise by the patient. All right, like for example, some questions and concerns. Do I need to inform my employer? Or I have some insurance papers from my insurance company, and please don't tell them that I have epilepsy. And in fact, the patient is driving in that company. She is a driver, a bus driver or something. Okay, so, and how you should deal with that, we will discuss it in during the course. Okay, and any insurance issues should also be dealt with when you discuss with the patient. So these are examples of some concerns that you may face when the surrogates when they tell you about their concerns. So it's important that you are prepared on how to respond to these issues and how to advise them appropriately. Okay? Please don't forget to show empathy, sympathy, and to check understanding through your consultation. You need to be empathic. You need to put yourself in the patient's shoes, okay? And you have to help them. When you do that, you need to provide help and support so they know that you are there for them, okay? We will explain the difference between empathy and sympathy during the course, and you need to check understanding throughout your consultation. I mean, you should not just spend these 14 minutes just lecturing and explaining to the patient the diagnosis of epilepsy and just not assessing their understanding or checking if they are following you, or if there are unsolved or understood points. Okay, you need to stop every few minutes and assess the understanding and the patient is actually following. Okay, so this is a slide taken from the Driver and Vehicle Licensing Agency Guidelines for 2018, okay, as our course material is updated. So, like as you can see, the highlighted points in yellow. Okay, this table describes patients who hold a Group 1 driving license, and these are patients who drive car and motorcycles. And we have the second column represent the Group 2 license holders, and these are the bus and lorry drivers. All right, our patient, she had 2 fits. If you remember that we had a line under 2 fits, the word 2 fits. This is the importance and the significance of that. Okay, as you can see, the first category is for epilepsy or multiple unprovoked seizures, which is the category of our patient. And she is a Group 2 license holder. She is a bus driver. Okay? Her job, her occupation is a bus driver. So here, you should advise her that she must not drive and must notify the DVLA. The person with epilepsy must remain seizure-free for 10 years without epilepsy medication before licensing may be considered. She must understand that. And you have to deal with all the reactions she may show you during the consultation and become angry, and here you need skills to deal with an angry patient, or she may just wants to keep the issue confidential and she refused to inform the DVLA. Hence, always ethical issues should be dealt with during the discussion. As I said, we will discuss this in detail in the Fitness to Drive and the confidentiality lectures. Okay? If you are interested in our course and to attend all our lectures, please contact Dr. Mahmoud on his contact numbers and follow us on our social media. Thank you for watching.